Hey guys, John Walk here, LMP Lancaster Online. We are outside of the new Clinic for Special Children facility in Leacock Township. I'm here with Mr. Adam Heaps. Adam, introduce yourself, your role, what you do here at the clinic.
Hi, so my name's Adam. I'm the Executive Director here at the Clinic for Special Children.
And this new facility, you guys moved over from Strasburg Township to Leacock Township. When did you start seeing patients here?
So just on April 8th is when we officially started seeing patients.
So we're going to go inside, we're going to check out the interior of it and talk to you folks along the way about some of the cool features. All right, so we're in here at the lobby. We're going to pause quick just to talk about the Clinic for Special Children, the kind of patients that you treat here and how that benefits the community.
Yeah, so the clinic was founded in 1989, so 35th anniversary this year. So for 35 years, we've been providing care to children and adults with genetic disorders, primarily from the Amish and Mennonite communities, but we do see patients from all over the country and all over the world. Clinic's a little unique because we are at our core doctor's office, so we see patients here. We also have a lab, so we do a lot of our own genetic testing, we do a decent amount of research, and also education for the families that we serve. As
we are walking around here and even in the lobby, you'll notice kind of the timber frame design that's on the interior here, and that was very intentional in terms of, hey, you have a lot of Mennonite Amish folks coming in here and you want to keep with that homey feel like you had at the original facility. You incorporated that here.
Absolutely. So in the original building, it was a true timber frame structure. So this was all structural in the old building. In this building, a lot of this is just for aesthetics, but we wanted to bring that comfortable feel so that when people would walk in, it wasn't like you're walking into a sterile medical environment. But one of the things that I think people always find interesting about the clinic is that we're doing cutting edge medicine with very traditional communities. Right. And so people are sometimes like, oh, you're doing this interesting, new research and medical for folks that may not have electricity in their house. And this building is also designed in that way. So there are spaces like the waiting room where patients come in that are meant to have a very homey, traditional feel, but then you go to our lab and it's very modern. So this is our main clinical area. So patients would come through a door from our waiting room. Typically we get heights and weights and then go into one of our exam rooms. In total, we have 9 exam rooms on this floor. We have 12 in total. In our old building, we only had 5. So it was a big expansion of the number of exam rooms that we have. And we were very intentional on how we designed these exam rooms as well. And we got feedback from families, from our staff, in order to make these. So one of the features you'll see is that there's kind of a barn-style slide door here. And so this is both aesthetics, because it looks nice and kind of goes with the more agricultural feel, but also eliminates any door swing. So it allows us to use the entire space inside the exam room. We have 2 styles of exam rooms. We have one for children and one for adults. This is one for children. So this has a flat top table, some cabinetry, but you'll notice that the back half of the room is essentially set up as a sitting area. And the reason for that is our patient appointment times are typically quite long. They're an hour for a normal appointment just because we do so much education and we see patients with complex disease. But most of that is actually done sitting down with families. And so we designed the rooms intentionally to have a nice place that families and the physician and genetic counselor and the nurses can sit and talk with families. We have 2 family rooms in our clinical area, which are essentially seating areas for patients. So one of the things that sometimes will happen is patients will come, families will come, and they'll see one of our providers as well as one of the specialists that comes and sees patients here. So maybe they're seeing the ophthalmologist and they're also seeing one of our providers. And there may be a little bit of downtime in between those appointments. Families can sit in here and relax without having to go back to the main waiting room while they're waiting for their next provider. Or if for some reason family members need to step out of a room for a few minutes, it's a spot where they can sit and relax. So trying to make it very comfortable for families as they spend, sometimes a half a day here. So this is our family discussion room. This is for appointments where there's not an examination part of it. So we have a psychiatrist and a psychologist who come from WellSpan and see patients here. So they typically use these rooms. But they also can be used by our genetic counselors or any other sort of conversation that our providers will be having with families. So we intentionally designed this particular room so that there's both a seating area and then also kind of a dining area where you can sit on the table. So I know the psychologist that uses this space is really happy with it because it just gives her a lot of areas to use for patients. So one of the specialists that we have that sees patients here at the clinic is an audiology team from the Moores in Wilmington, Delaware. There's also an ears, nose, and throat doctor that comes and see patients. So we use this booth, they use this booth to be able to do evaluations here on site. This is more state of the art. So this has 2 chambers to it, which is different than the one that we had in our previous building, which only had 1 chamber. And so the big advantage here is the person getting the test is in a chamber and the person giving the test is in their own chamber. And so that just allows you to get more accurate results. This is also down here in the basement where you don't get a lot of vibrations from the building. And it's even as far as the booth is not actually physically touching any of the walls to get even less vibration from the building. That's how precise it is. So this is our lab. So we have an on-site clinical laboratory where we do a lot of our own testing. A lot of the testing is genetic, so we are actually sequencing DNA down here in the basement, and that just allows us to have rapid turnaround for genetic testing for families. So a lot of times if we have an idea of what it is that the issue may be, we can confirm it here in the laboratory very rapidly, and then we can let the family know. And if there is a treatment that's available, we can get right into that.
The original building really was designed to have a very small analytical lab on the main floor. The problem was it was a very small laboratory, and when I started work at the clinic, we had all of our equipment sort of piled in there, and there was just one of me, right? So we didn't have any technicians. All the work was done by me. What's nice about this is we now have one big, large space where we can all work without bumping elbows, and we can get a lot of work done, and we have room for expansion as well. It's just nice to actually have this a meaningful, purposeful lab that was set up to actually do this work.
So this space allows you as a clinic to do what?
So what we've used it for so far is a couple times a year, particularly over the summer, we have what we call our family days. So we invite all the families that have a certain disorder or a group of disorders to come here and learn about the disorder. We invite specialists that are relevant to that disorder, go over ongoing research. It's a social day for families. And so what we're able to do here is set up tables and chairs. We used it for lunch, which we served out of the kitchenette right there. And then we also used it for kids activities. So while the parents are in the conference room learning, a lot of the kids are out here working with our staff doing crafts. So it's worked out really well. We see patients primarily from Pennsylvania, but we do see patients from all over the country and all over the world. And so what we learn here is applicable locally. It makes a big impact. But then we're also sharing those findings through peer-reviewed publications in scientific journals, conferences. Because there are patients that have these disorders all over the world. They may be less common, but it does happen. And so we can share that information in a way that other physicians and researchers can access it. So there's a direct local impact, but then this reverberation really all over the country and all over the world.